friends, Deborah here. Today's video is what I was talking about, I think in my last one or on my Instagram post, but it's my medical supply organization. Everybody does everything different, so this is just how I find it easier for me to do. I'm very OCD when it comes to my stuff, so we'll see. I got this great cart. I don't think you're getting a full view of it. I don't even know if I turn it over, you might not get a good view, but it's got 5 compartments and they pull out. And what I've chosen to do was put everything I need in each drawer as needed. I've got the top drawer here is my everyday stuff that I use every day. This drawer here is my pain relief center. This drawer here is my GI supplies, stuff that gets me through the day, when needed, whatnot. This one here is the extras, my backups when needed. I try and keep ahead of everything so that I don't run out of anything, because if you have any kind of chronic issues at all, you know that running out of anything like Pepto-Bismol is a main issue. So you'll see that. And then the bottom drawer is some supplies that are more so, really, I guess I would call them things I use to, and the bottom drawer I use for medical supplies and first aid, etc. So we'll start out with my everyday drawer, the top drawer. I'm going to pull it out because I don't think the camera is getting it. So I'm going to get that. And while I do that, please do me a favor, hit the bell, hit subscribe. I would really appreciate the followers. I'd love to have you guys along with me on this journey. I've got so much coming up. Just got out of the hospital recently, again for sepsis and other stuff, and I've got a lot of follow-ups and a lot of things that we're gonna see they have suspicion for, along with my regular chronic illnesses. But so it would be definitely some interesting stuff, and take you along with my husband and I when we go do some things, because there are some days that are good days, some days that are bad days, and we'll see. Okay, so anyway, back to, this is my top drawer. This is my everyday drawer. Okay, so in this drawer I have, this is what I depend on every day of my life. Anything I eat that has lactose in it, which is very rare, but just in case, is my lactate. So that's in there. I have got my pill sorter, I guess you would call it, that every day I take out. I usually during the week take each container and fill them with my supplies for the week. So I have just my regular medication on hand. I have, okay, trusty old pill crusher. Everybody's got a different one. This one's an old one, actually. I've got another one in there. Excuse me. I've got another one in there that's more popular, but for me, this one works the best, so that's what I'm going with. Okay, we have, I'm going to try guess this is okay if I show the name and stuff. I have clonazepam, which is Klonopin, for anxiety and whatnot. You know, with chronic illness, it's gonna happen. You're gonna have that. Levothyroxine, that is Synthroid for my thyroid. I have Lexapro for, it's an antidepressant. I have Lipitor under the generic name. That's for my cholesterol. I don't eat bad. Obviously, you can see by the bones on me that I am not eating that well. So, but I have the, I believe it's genetic, where you just, your numbers don't want to work with you. And then I have something called Quetiapine, which is for many uses, but for me, it's used for sleep. Anything that's going to help. And then I have Furacet for migraines. These are just my daily stuff that I use no matter what, and I don't have to worry about finding them. Okay, second drawer. Second drawer is my where I keep my pain supplies, mostly. A lot of them you'll know ahead of time I can't survive without. I have my over-the-counter stuff, and I've got prescription stuff. So a little bit of everything here. We have, these are the best things ever. Just so you know, be cool. They're for fever, they're for headaches. I get migraines, I get fevers, and they work the best for me. I use them probably every day. I keep Azos. Ladies, you know what that's for. I get a lot of UTIs, which is one of the reasons why I was in the hospital with sepsis a month ago, probably about a month and a half ago, because I had a UTI and an upper respiratory infection, which combined led to pneumonia, which led to sepsis, and not a good combination. We've got some, I'm not going to pull them out, I guess female, again, female issues we all have, but I don't know if I'm comfortable yet with that. We've got your Oragel. I've lost a lot of the bone structure because of health issues, which I never knew before was an issue. I didn't realize your medical health would affect your teeth. And so I've lost a lot of teeth, lost a lot of bone quality, I would say. So I get a lot of pain with that. Not fun. I have one of my diagnoses. Recently, I wound up with a visceral, I believe that's what it's called, detachment in this eye, which is not a retinal detachment, but it's when the matter or gel behind the retina detaches, and it's happening on this eye too. So I have like one droopy eye and the other eye looks funny, but that's basically because I can see good, but I see lines. They call them like spider webs, which there's no cure for. It's just something I have to deal with. So when that does give me a headache, because sometimes I get what I call an eyeball headache, I use a lot of pain relief as far as I don't have anything real prescription pain medication. I have turned down most of them. I don't do well. I'm allergic to Vicodin. I don't do well with oxycodone. I have reactions to so many pain medications, prescription, that's really hard. So I have to rely a lot on over-the-counter medications, which is why it costs a ton, because, you know, when you get things through your doctors, you know, if you have good insurance or decent insurance, you can get them covered. And I'm working on that, because I believe some of the stuff that I can get from the doctors, just under different names. So when I do get those headaches, though, I use, this is called Roto All-in-One. It's an eye drop, if you can see that. It is something that is more of like a cooling agent, and it helps a little bit with the eyeball pain, very short period of time. Otherwise, there's really not much you can do except for go to your trusty old Tylenol, which I choose to use the extra strength rapid release. Works the best for me, at least, you know, to whatever degree that. Then I have, did I put it in here? Yeah. And then I use just ibuprofen. You can use any brand, but I choose to try and save money wherever I can. So I'll use name brand. I'll use store brand, whatever is on sale. This one was a CVS one. So I will piggyback the Tylenol and the ibuprofen, because this is supposed to take every 6 hours, and the ibuprofen, I think every 4 hours. So I piggyback, which most of you will know, after about 4 hours, if I'm still in pain, I'll stick some ibuprofen in between doses of Tylenol, and that's just for really severe pain. And if it gets really bad, I have an actual prescription grade. It's higher milligrams. I believe it's 800 milligrams of ibuprofen that was prescribed by my doctor if I really need it. Sometimes I do, and when I do, I do. Can't be ashamed of it. It's the way things are. The other thing I have for, I had neck surgery. I had a C5 through C7 discectomy with fusion. I have cadaver bone. They had to remove some discs, and I have a plate, it's a titanium plate and screws. So I get a lot of pain with that, even though they did a great job, and they saved my life, because once they got in there, one of the discs actually broke apart, they told me. So I have to be very, very grateful for that, that they found it in time. They went in, and you got to deal with the pain. But when I need to rub something on, I use something called diclofenac sodium topical gel. It's prescription. That gives a little relief, you know. Usually, like everything else, it gives you some relief for a couple of hours, sometimes a couple of minutes, sometimes not at all, but I do use that. And then one of the main things I use for my shoulders when I have headaches, or my back, or even my stomach sometimes, is probably one of my favorite or most next is the drawer that I set up for GI issues. I have an appointment coming up because there's a lot I need to go over with my GI doctor every 2 years, probably for the last 20 years. I have to have an endoscopy and a colonoscopy. That started out with because of my history of polyps and so forth. It led into needing to go do that often because I have something called dysphagia, which has to do with swallowing and choking, because when I had my neck surgery, you're intubated, and for me, I have a very small trachea, so the intubation is not great for me, and that particular surgery lasted about 6 hours. So when I woke up, they said it would go away. It was something normal. It didn't. So I spent about a year, almost the first year of, going back and forth between liquid diet, then mushy diet, like baby food diet, and then soft foods, and then I took things like pretty much everyday normal food and used a bullet to get it down, and then eventually I got myself to where now I can eat solid food. It just has to still, even after 5 years from my surgery, I still have to cut it really, really, really small, whatever I'm eating. And even then, every single day, I usually choke and have to, sorry, TMI, I have to spit up something to get my, open my airway. Not much I can do about that. But I have diverticulosis, I have gastritis, I have motility issues, I have pelvic floor disorder, more so related, not so much to the front, but to the GI issues. I had one of those tests done where you swallow a pill, and the pill is radioactive. It releases little beads of radioactive things. Then every day for 5 days you go and get an x-ray to see where it's moving through your system. And I obviously didn't pass because by day 4 of, my 4th x-ray, it was still showing up in my GI system, the iodine. So it, I have motilities, which is, that goes with a lot of different diagnoses, which I'm sure a lot of you know about. But we're still working on that. Important medications, and that is the Zito-Lido patches. These are really expensive. They come in individual packs like this. I usually take them out of the box and put them in here so they're easy to reach for, but these, at least for me, they're lidocaine patches. So usually I'll have to put 2 or 3 on. It depends on what part of the body is hurting at the moment. And they're pretty expensive, even with insurance. But you get a lot of them. So when I do order them through my pharmacy, they need to place an order outside of the pharmacy, because they don't usually ever keep these stocked. So I get 3 boxes of these, and it's $60. So for me, that's pretty expensive. But like I said, it's something that I honestly can't do without at all. So that's some of the pain medications that I use as... Hi, this is future me. Just letting you know that my editing is going to be horrible. Please forgive me. There's a lot of breaks in between, but I'm doing the best I can, so try and get through this, okay? Thank you. Okay, so for GI, what I'm using over the counter at the moment, cannot live without the Tums, but I can't use the regular Tums because they're just too, I find them too chalky. So these, if you're looking for Tums or you need Tums, I literally cannot say enough about the smoothies. Make sure you're getting the ones that say smoothies on there, and you can get different flavors. I have these are assorted fruits, but make sure they say smoothies. They are not chalky. You can chew them, they have a good taste, and they help. I sometimes get in a lot of pain with my stomach because when I eat, which is unfortunately not a lot, I eat breakfast, which is usually oatmeal, and I really don't eat during the day. I'm supposed to. I try and do a little bit of yogurt, but again, it's a milk issue, so that's kind of hard. So when I get to dinner, let me grab that first. About an hour before dinner, I have to take a Pepsid, and that's because of my GERD, gastroesophageal reflux disorder, or acid reflux, you could call it. This just became a must again. I was doing it a long time ago. Excuse me, that's an example of it. I'm really sorry, but gotta keep it real. That's because I'm talking, so I'm getting a lot of air in there. But this is a must. I have to take this before I eat. And I try and do it in 2-week periods. Do it for 2 weeks and then take a break from it, because nothing is really good for you long term unless it's absolutely necessary. So I try and keep it to the best I can. But also, when I eat afterwards, I bloat. I actually bloat during the meal, and there's not much that doesn't do it for me. I can eat as clean as I want. My husband is really, really good at that. He's very, very healthy, and he likes to eat clean, and I'm grateful because we buy organic grass-fed meat, and I only eat chicken when it comes to meat, and everything else is very, very clean ingredients. We don't eat fast food and stuff, and it's not because there's anything against fast food by any means. Don't come at me for that. It's just because I can't handle fast food. It just kills me immediately. I mean, believe me, if I could go get a big smashed burger or a what do you call those fries? Baconator fries. Oh my God, what I would do to sit down with a big bowl of Baconator fries. But that's not possible because after everything I eat, I have really bad pain So we go to the good old trusty Pepto-Bismol. For me, this is like, it coats your stomach or my stomach, and it gives me a little bit of relief for a while. I couldn't do anything without this, but unfortunately that also constipates you. So that will lead you to needing Dulcolax when that does happen, because being on medication and using that, Dulcolax is something that's needed. On the flip side, there are times when things really don't agree with me on an opposite level, and then when that happens, we know what this is. Good old-fashioned Imodium. And I like the multi-symptom one. You can see right here, this is the multi-symptom one. They do have the regular one, which works fine. This one just gives kind of like a little bit of everything, a little kick of everything, and that's good enough for me. And then, most importantly in this box, nausea. Nausea is probably one of the worst GI things I can describe. I think most people feel that way, but it can keep me up all night. I cannot deal with it. So for me, I use Zolfram. The generic name for it is ondansetron, but it's Zolfram. Prescription, and these you take out, and let me see if I can do this without dropping. They come in tablets. You have to be really careful with this. When you open it, you have to try not to get it on your fingers, so you slide it back, you leave it open, it goes under your tongue, and then you close your tongue and you let it melt. It's been working really well, although when I go to my GI appointment, I am going to probably have to talk to him about something a little stronger for nausea. Don't want to, but it's something that's got to be done, because sometimes that just isn't, sorry about the camera, sometimes that just doesn't do the trick. And the next drawer I have is my backup drawer, which I usually have a lot more in here, but this is a lot of, usually extras of things that I may need. It's extra migraine pads. It's usually got about 2 extra boxes of the lidocaine patches. They're empty here. I only have what I showed you up there because I'm waiting for my pharmacy to get them in. I have dry eye syndrome, so it's not in my daily bin. I have it in another bin, but I use an eye drop. It's really, really good for dry eyes. It's called Sustain. I use the Ultra, and I use it all day long. I think you can use it a couple of times a day, but my doctor lets me use it more than often, so I keep a couple of boxes. They're always on hand. I have to keep extra boxes because I use them often. not much I can do. I have 2 extra prescriptions that came due, and I wasn't done with the others. I have no idea what that is. I either forgot, did a brain fog, to take something, or I don't know. I have no idea why 2 of my regular medications I take daily, I've got full boxes. The pharmacy called me, full bottles. The pharmacy called and said that I have extras, so there you have it. Oh, I keep in my pocketbook. This isn't just in here so that I know. I keep in my pocketbook an albuterol. That's for like, we call that the emergency pump, because I have another pump. I don't know why I don't have it out here for you, but I'll show you that another day. I use twice a day, in the morning and at night, just to keep the airways open in the lungs. But I keep the albuterol in my pocketbook so that I have it with me at all times, and that's just for when I'm really feeling out of breath, or having an asthma attack or something. Then I can use that. But I keep the empty bottle here so that I can look on the back and see when it's due, and so on and so forth. Another thing that I use, and I keep in this drawer, is stuff for colds. I don't use a lot of over-the-counter stuff for colds, because, believe it or not, with all the chronic illnesses that I have, I don't get a lot of colds. Fingers crossed. So there's only really 3 things I have in here that I use, that I think I probably have so much going on that my body's like, screw it. She's not getting the common cold. She's got enough going on. I'm just going to wham her with more new diagnoses, but I'm not going to give her a cold. So I have if I could read or see, that would help. But again, eyes not good. It's kind of like Flonase, but it's prescription. If you can read that, bless you. God bless you. But this is during a cold. There's that. That's about as far as I would go. Is that Vicks Vapor, old school? That shows you my age. No shame. And then I have a prescription for cough. Instead of liquid, they give me pills, which I honestly have no idea what they're thinking when I have such an issue with swallowing. Because everything, normally, if it's not in a gel, then it gets crushed, because it's just too much. But it's something called benzonatate, and I don't even see a real name for it, but it's 1 capsule and it's for cough. I could use liquid, but with the medications that I take, I really don't like to take some of the liquid normal cold medicines, because I just feel like they make me super tired. So, and lastly, on the bottom, nothing exciting. I'm very lucky right now. This may change, because we do have a few things going on and a few doctor's appointments that we'll see. But in here, I keep really not a lot. I have, this is the extra pill crusher I was talking about. I think a lot more people use this than what I use. It screws on like this or screws off like this. You put the pill in there, you put this on, and then you just screw it until it crushes. And I used to use this actually, but it was just annoying the hell out of me, to be honest. I was going to make up an excuse, but I'm not going to make anything up. It just annoyed the hell out of me, so I stopped. And I've got, I bleed very easily also. I'm not on any blood thinners, so that's a little confusing, but I'm a bleeder, as they call it. I can have a flu shot or a blood taken, and I will blow every vein in my arms. It's a nightmare. So I always keep, the hospital gave me a packet. It is of just pure old Curad pads and some tape, and that I have to use sometimes at home because I have cats and I get scratched a lot. I thought I had a scratch here to show you. God knows I have a million, so I don't know where it is, but I got scratched again today. And sometimes Band-Aids, again, store brand, no reason to go buy something that costs more. Sometimes that just doesn't do the trick. So that's where the Curad pads come in. And then I have this good old-fashioned, babies use this. I used to use something like this for my daughter when she was little, to put her medicines in, but there are a lot of vitamins that are liquid, and I was using them for a while with my dysphagia, and when it gets bad, I can use that. And when I do, this comes in handy. I just pull up the amount of teaspoons or milliliters, depending on what the bottle says, and life is good. And just regular antibiotic ointment, which also is for the scratches. One of the things that I still held on to that I don't need right now, thank God, but the last 5 years has been a nightmare as far as surgeries, 2 shoulder surgeries, mind you, arthroscopic at least, broken wrist, thumb locked, and I needed surgery to unlock that, and then they casted the arm, but when they took the cast off, I wound up with CRPS, and some people refer to it as RSD, reflex sympathetic dystrophy, and at the time, it was about 6 months that I had to do occupational therapy because the hand, which it's still at times, it will swell up out of nowhere. I do not know why. It is annoying as hell, and it's just, it's gone past painful. I don't have pain with it anymore, thank you God, but it does. It's just annoying. But when I first got it, they took the cast off. I was so excited. The doctor was so excited. And they took the cast off, and I screamed holy murder, because when the cast came off, it just released this pain that I had no idea existed. And I was casted up to the fingertips. So the fingers weren't moving really. So I didn't know what it was going to feel like. So when they took it off, ooh. But anyway, I can't get this out of the bag. If you can see, a lot of people have to use this. I had to use this to eat, because with this hand, I wasn't able to bend the fingers for a long time. So if you can see, it's through the bag. I can't get the baggie off. It's rubber, and it goes around a fork and a spoon. Obviously, spoons are easier, and I would have to use this, because I'm right-handed, to scoop my food up like a child. But it is what it is. And then also at the time, your good old-fashioned, I had to wrap this around the other wrist, the good wrist, because this wrist that had the RSD was a nightmare, because if the wind even touched it, it was like being stabbed with needles. So I would wear something over it, not a glove, but more of almost like a gauze that you would put over, just so that the wind, the air wouldn't touch it. And I would put it on from here to here. And because of the lack of use of this wrist became overused. So yeah, you good old-fashioned that. And then last but not least, I don't like this. I've never had to use it. Thank you, God. But everybody should have it in their house anyway if you take a lot of medications. If you anticipate taking more, it's something that I think is really, really important. And that's Narcan. I have 2 of these. At the time, probably a year ago, the state, depending on where you are, I'm in New York, the state offered free 2 Narcans per household. And it was suggested to me by my doctor, keep them in the house, because you just never know. Because even though I'm not taking any kind of actual severe or heavy duty pain medication by choice, I still have an issue that I have to be careful with the Furacet. If I have brain fog, so a lot of people have brain fog, but I also have a frontal lobe issue. So that's something that they describe it as affecting your decision making, but it's also an issue that comes up a lot, and you'll see in my future videos where I will stop talking, which I've probably done during this video 100 times, and I don't even know it yet. I'll see it when I go back and edit. But I'll want to say a word. I did it to my husband today. We were talking about big storm that everybody's had all over the place, and I wanted to make sure that we had extra flashlights. And for the life of me, the picture of it, I could picture flashlight in my head. I could see the word flashlight in my head, but it wouldn't come out of my mouth. Could not, for the life of me. I literally was going, honey, tell me what this is. And he's like, what are you doing? And I'm like, it brings, it helps you to see things. You press it and you go like this, and stuff comes out. And he's like, what stuff? What are you talking about? And he literally wasn't making fun of me. It was just, I wasn't even getting that correct. And I'm like, finally I said, you press it and you hold it like this, and light comes out of it. And he's like, a flashlight? And I'm like, yeah. So, you know, I was tested. I took a test with one of my neurologists, and I have a mild frontal lobe disorder, and that is technically it goes with the problem solving issue, but it also is something that you picture the words, you just can't say them, or you do what I did probably throughout this whole video and go but you'll get used to that. And you know, so the reason that I thought it was really important to have the Narcan in the house and teach my husband how to use it is because I also have had in the past, it only happened once, where the ambulance had to come and I had to go to the hospital. I took my medication and went back again about 5 minutes later and thought to myself, oh, don't forget to take this medication, and took the medication again. And within 10 minutes, it clicked. Wait a minute, I think you just doubled up on it. And at the time I was on like oxycodone, and that was because it was after one of my surgeries, and there was other issues which will come up one day. It was a day that it was a funeral, and it was my father's, and I'll explain that to you because I have to wait and make sure how I put a trigger warning on this, on how he died. So I was a little mixed up. But anyway, we had to call an ambulance, and I had to go to the hospital because technically it's considered overdosing. Whether it's by accident or not, it was an overdose. So that was a very important reason why I have that in the house. And I think if you have chronic illnesses, and if you take pain medications, or really any medications, a lot of them, because you could take 12 Tylenol and overdose in that sense. So I think it's something very important to have in the house. And, you know, whoever you live with, if you do have somebody living with you, teach them how to use it. So that's what I have at the moment in my cart. Now, I have other stuff, but this cart, my husband was nice enough to set up for me. And I haven't filled it all the way yet. And not that I want to fill it up all the way, but that's what I have in there for now. So please, guys, if you think this is going to be helpful, this channel for you, I really do have a lot to talk about. There's so many different, sadly, diagnoses. It's unbelievable that I have. Then I will pull out all my reports, and I will start, once I learn, inserting pictures of what my spine looked like, the discs that were cracked, the bones that were broken, the whatever. I will start inserting them once I learn how to properly do that, because I am starting out with this. And I'll have some other stuff too. I will try. And, you know, I have a lot of doctor visits. I have a lot of things like that. I'm not doing a lot of, since I did come home recently after the sepsis, I haven't done a lot of fun activities to take you on, but I would like to throw that in there somewhere and start doing some more videos. So I'm trying to get healthy. I'm trying to get myself a little stronger. I have protein drinks on the way. Core, if you hear me, love you, love you, love you, love you. I just ordered a bottle and I loved it, the chocolate milk, and I haven't tried the vanilla yet. I say chocolate milk, but it was chocolate flavored. But protein drinks, shakes that are amazing. So I'm trying to get a little stronger so I can do a little bit more and help a little bit more and talk a little bit more, and maybe something on this video, maybe something on the upcoming videos will resonate with somebody out there, and maybe there's something I can help you guys with that I'm learning as I go along, or that I've already learned. And all you gotta do is hit subscribe, smash the bell, and please follow me, Instagram, TikTok, most importantly here. And if I see that you guys are interested, I will make videos a lot. I will take every subject I have, because I have a lot of diagnoses. If you look on my page, what I'm living with, and I will take one by one and discuss them and give you any information I have that could help you or you can relate to. So please, once again, hit the bell, subscribe, and I will speak to you soon. Have a great night. Bye, and thank you for watching.